Welcome to the Deep Dive. This is where we take your source material articles, research, maybe even your own notes, and really zero in on the absolute most important nuggets. It's all about cutting through the noise so you can, be instantly better informed. And today we're diving into something I think is incredibly practical, especially if you ever find yourself traveling or living abroad. We're using excerpts from a document called 17 Do You Need a Doctor in Indonesia? The goal is to tackle a specific challenge navigating medical situations in Indonesia. So let's set the scene. Imagine you're there, maybe on vacation, could be you live there, and suddenly you or someone you're with feels unwell. You're in a foreign country, maybe not totally fluent in the language. What do you actually do? Where do you go? It sounds pretty stressful, right? Yeah, so our mission for this deep dive is really to distill the key phrases and the cultural insights from this source material to equip you. By the end, hopefully you'll have a clearer idea of what to say and where to seek help if you ever, face a medical issue in Indonesia. Okay, let's unpack this scenario. The source jumps right into a core situation, a really urgent one, needing to find a hospital because someone is sick. And it gives us what seems like the absolute foundational phrase you'd need. Teman saya sakit maki, di mana letak rumah sakit terdekat. Which translates to, my friend is sick, where's the nearest hospital located?
Yeah.
This feels like the absolute priority, doesn't it? Just expressing the core problem and asking for directions to, the most critical resource.
Absolutely. And what's fascinating here is how those few words capture so much essential information. And the source immediately breaks down the critical vocabulary that's embedded right there in that initial exchange. It gives us the building blocks.
Building blocks for what exactly?
For expressing need, describing illness, and crucially, asking for location. Think about the core words you need just to convey a medical need. The source highlights words like butuh, that means to need. You might say, saya butuh bantuan, I need help.
Okay, butuh, need.
Right. Or bantuan itself, which is the noun for help. The source points out, interestingly, that it comes from bantu, the verb, to help, with the feron suffix. That's actually a useful linguistic nugget, showing how words are formed. And while bantuan works for most situations, the source does mention pertolongan as being a bit more formal. So that's a good nuance to know.
Okay, so you've got, I need help. Saya butuh bantuan. That's the foundation. How do you then say what the problem is? Beyond just needing help, you need to say someone is actually sick.
Exactly. And that's where sakit comes in. It's really crucial because it means sick or ill or even hurt. The source shows how versatile it is. You can say, teman saya sakit, my friend is sick. Very straightforward. Or you have a specific pain, you combine sakit with the body part. The source gives us saya sakit kepala.
I have a headache.
Exactly. Literally, I'm sick on the head. And saya sakit perut.
I have a stomach ache. Sick on the stomach.
Right. So that structure, sakit plus the body part, it's a clear pattern the source points out. It helps you describe different kinds of pain.
Okay, so the pattern is saya sakit plus body part. That's a really clear takeaway structure from the source for describing localized pain. Does the source mention if sakit is used for just, any level of pain? Like a mild ache versus something severe, or is there another word for that?
That's a great question. The source doesn't explicitly detail different levels of pain associated with sakit. It presents sakit as the sort of general term for pain or illness connected to a body part or just general unwellness. So based purely on this material, yeah, sakit seems to be your go-to word for expressing pain or sickness in a specific area or just feeling sick overall.
Okay, got it. So we can say someone is sick generally with sakit, or specify where it hurts using sakit and the body part. Now, how do you find where to go? The location part.
Right, location words are absolutely vital. The source gives us dekat. That's near or close.
Simple, yeah.
Simple but essential for finding that rumah sakit terdekat, the nearest hospital. And letak is the noun meaning location, as in di mana letak rumah sakit. Where is the hospital's location? So these words, dekat and letak, combine to form that key initial question we started with.
And if you get directions or maybe someone offers to take you, the source includes a verb for that too, doesn't it?
It does. Menggantar. The source highlights that menggantar means to take or to deliver, but specifically when you're taking a person somewhere.
Oh, right.
It's distinct from taking an object, which would use a different verb like mengambil. So if someone says, saya akan menggantar kamu ke rumah sakit, they mean, I will take you to the hospital. It's a useful bit of precision from the source's vocabulary list.
Okay.
The source also mentions leat, which means through or via. You might hear that if someone's giving you directions, like lewat jalan ini, go via this road.
That distinction, taking a person versus an object with menggantar, that's a great little nugget of language insight from the source. Okay, so we've covered expressing need, identifying the sick person, specifying where it hurts, asking where the hospital is. What about that general feeling of just being unwell? You know, maybe like with a cold where it's not one specific pain point.
Yes. The source gives us a perfect and apparently very common phrase for that. Saya tidak enak badan.
Oh, I remember seeing that. The source breaks that down literally, doesn't it?
It does. Saya tidak, not enak, good, pleasant, comfortable. Badan, body. So literally my body feels not good.
Huh. Okay.
Yeah, and the source emphasizes this is a really common and natural way to say you just feel unwell, especially if you're, catching a cold or just feeling run down. It's less specific than, say, sakit perut, but it clearly conveys that general sense of being off.
That's really useful. Yeah, it covers that common situation of just feeling generally poorly. Okay, now let's escalate a bit. What if the situation is an actual emergency? You need more than directions. You might need urgent transport.
Right. For an urgent situation needing transport, the source provides the phrase, tolong panggilkan ambulans.
And tolong there means help, please.
Well, tolong is quite versatile. The source points out it can function as a verb meaning to help, or as an adverb meaning please. So in this phrase, tolong panggilkan ambulans, it kind of acts as both please and help call an ambulance.
Okay.
Panggilkan is the verb to call, and ambulance is, ambulance. Pretty clear. So that one phrase covers the urgent request nicely.
Okay, fantastic. So we know how to ask for help, say someone is sick, specify pain or general unwellness, ask for directions to a hospital, and call an ambulance. Once you potentially get to a medical facility, the source includes a few examples of phrases you might hear there too.
Yes, these are helpful for navigating the immediate steps right when you arrive. For instance, you might hear, silakan tunggu di ruang tunggu.
Which means?
Please wait in the waiting room.
Yeah.
Silakan is another polite please.
Right.
Or if you need to register or give details, you might hear mohon isi formular ini.
Please fill in this form.
Exactly. And the source notes that mohon is another polite way to say please, maybe slightly more formal than tolong in this kind of administrative context.
Okay.
And going back to sakit, a doctor or nurse might ask you, di mana sakitnya?
Where does it hurt? Using that same core word for pain.
Precise.
So we have the language tools for communicating the problem and interacting a bit at a facility. But this brings up a really important question based on the source material. Once you need medical help, where exactly do you go in Indonesia? What are the options the source actually describes?
Yeah, this is where the source provides some really valuable cultural and structural insight into the whole healthcare landscape. It's not just about finding a hospital, you see. There are different types of facilities serving different needs, and it's good to be aware of them. The source highlights these government-mandated community health clinics called puskesmas. It's actually short for Pusat Kesehatan Masyarakat.
Puskesmas, okay?
Yeah. These are apparently widespread, and they're aimed at serving lower-income families right within their communities. They seem to be a primary point of care. So knowing the phrase, di mana letak puskesmas, where is the community health clinic located, could be really crucial for finding local, accessible help, according to the source.
So puskesmas are kind of like local community health centers, mainly government run?
Exactly. And the source also mentioned something called Posyandu, which stands for Pos Pelayanan Terpadu. These are also community-based, described as integrated health and nutrition centers. They also tend to target lower-income groups, but focus specifically on health services for infants and toddlers.
Oh, okay. Like what kind of services?
The source lists examples like immunizations, weight monitoring, and nutritional guidance. So really focused on the very young. These seem really embedded within the community structure itself.
Interesting.
Now, beyond these community level clinics, the source does confirm the presence of, the kinds of facilities you'd expect: public hospitals, private hospitals, specialist clinics, the usual range.
Right.
But here's where it gets really interesting, and the source provides a key cultural insight. It notes a tendency, particularly among upper middle income Indonesians, to sort of bypass general practitioners and go directly to a specialist.
Really? Why is that?
Well, the source suggests this is sometimes due to a perceived lack of trust in the general practitioners.
Wow, that's a significant point from the source, the potential difference in how people access care based on income and trust, leading them straight to specialists. Does the source elaborate on why there might be that trust issue?
It doesn't really detail the specific reasons behind the trust issues, unfortunately. It just sort of observes this tendency and links it to that potential lack of trust. It's presented more as a cultural observation within the medical system there.
Okay.
And it adds another layer. Those who can afford it sometimes choose to seek medical services abroad altogether, particularly in nearby countries like Singapore and Malaysia. So this further underscores that layer of preference and maybe perceived quality difference depending on your resources.
Wow. Okay, that paints a much more complex picture of the healthcare options than just find a hospital. It really sounds like there's a whole ecosystem with cultural preferences heavily influencing where people actually seek care.
Absolutely. It's not just about availability, but also perception and trust. But, despite these challenges or preferences, the source does include a positive note. It mentions that medical workers in Indonesia are continuously working to improve their skills. It specifically says they participate in things like competency tests, seminars, and joint study and discussion groups. The goal being, obviously, to enhance the quality of healthcare services. So there's also an ongoing effort towards improvement highlighted in the source material.
Okay, so wrapping this up then. We've taken a deep dive into those source excerpts. We've hopefully equipped you with some essential phrases to express needing help, describe feeling unwell or specific pains, ask for directions to medical facilities, and even, crucially, call an ambulance. And we've also covered a few key phrases you might encounter once you actually seek care.
Right. And importantly, we've connected this language to the bigger picture that the source provided, understanding the landscape of medical facilities in Indonesia. From the local community clinics like Puskesmas and Posyandu through to hospitals and specialist clinics. And we've even touched on those cultural insights about patient preferences, things driven by trust and income, and also the efforts that medical workers are making.
Hopefully all this knowledge pulled directly from these sources gives you a clearer picture and maybe a bit more confidence if you ever find yourself needing medical assistance while you're in Indonesia. You now have some practical language tools and some important context on where you might seek help.
This raises an interesting question, though. Considering the different types of facilities and those observed preferences for specialists or even seeking care abroad, how might these factors influence the equitable distribution and the overall perception of healthcare quality within Indonesia for everyone? It really makes you think about the role of those community clinics versus private options and just how much trust shapes the patient journey, doesn't it?
That's definitely something to consider further. Thanks for joining us for this deep dive.
Thank you for watching this video. Hopefully useful. Don't forget to like and subscribe.